Dr. Terrance Malee. He is a local physician right here in town. He does 215 doctor's recommendations for patients. This is Dr. Terrance Malee.
Hello everybody, my name is Dr. Terrance Malee. I'm a Trinity County doc. I've lived in Trinity County for over 40 years. I'm presently practicing as a cannabis consultant in Northern Reading at Dr. Denny's old office. And I've been a physician for close to 50 years now. I have about 15 years as a family practice doc. At the end of that, I went into natural medicine, holistic health, did herbs and home deliveries. Then I went into emergency medicine, did about 15 years of emergency medicine, in which I was the director of emergency services at Trinity General and Trinity General Hospital. I then did what most docs do after they get burned out on ER. I went into urgent care, did that about 15 years. I was the medical director of Greenville Rancheria and Everyday Healthcare in Reading. I am now presently a cannabis consultant, and I want to talk about a few things. One, what we do as cannabis consultants. Two, what cannabis works for. Three, how cannabis works in the body. And four, how to make some medicines out of cannabis. So basically, how we deal with deciding whether or not somebody had the right to a cannabis. 215 is when we do a history physical on them, then we go through their medical records, and they need a prior diagnosis of a chronic medical problem that cannabis will work for. And if all these things work out, then they get their 215 or the right, which is the right to use cannabis, it's the right to possess cannabis, it's the right to buy cannabis at the dispensaries, and which all should be a God-given right. We shouldn't have to have documents to allow that to happen. Well, that's the way our world is right now. And so basically, what does cannabis do? Why does everybody need this cannabis license, and what are they going to get from it? Basically, what cannabis does a multitude of things. It's a pain reliever, muscle relaxant, and anti-inflammatory. So therefore, it works great for chronic neck pain. It works for chronic low back pain. It works for quadriplegics who have severe muscle spasms and bladder problems. It works for paraplegics. It works for multiple sclerosis. It works for amyotrophic lateral sclerosis, because those are diseases of spasticity and severe muscle spasms, and cannabis will mop those right up. It also works on any generalized pain problem, which is osteoarthritis, rheumatoid arthritis, gouty arthritis, rheumatic arthritis. It just generalized chronic pain in everybody and anybody. It also works topically as an anti-inflammatory and a pain reliever, and can be used for any skin problems that are painful or periodic, because itch is just a supplemental pain. It can also be used topically on joints any muscle spasms or anything throughout the body. It's also a systemic muscle relaxant and systemic anti-nausea medication, and a systemic anorestic, which allows you to get an appetite. So it works great for cancer patients. It works well for AIDS. It works for chemotherapy when you have no appetite and you're wasting away. It works for wasting syndromes, cachectic syndromes. It also is a hypnotic. It allows you to sleep through the night. It works dramatically better than Ambien or Lunesta, just because it's mellow on you. It doesn't knock you out, and you don't do weird things when you think you're asleep. I have some great Ambien stories about one gentleman who woke up in the morning, found boxes of Taco Bell all around his house. He had gotten up in the middle of the night, threw the Taco Bell, came back, ate it, went back to sleep, and didn't know any of this happened. A woman did the same thing in her own home. She didn't leave. Another gentleman woke up in the middle of his living room floor with his leg broken underneath him from falling down while walking around. The other two are more embarrassing than dangerous, but there was a woman who awakened in the middle of the street in front of her house in a see-through nightgown as a car was approaching her with his headlights. And another woman walked in naked into AM/PM to buy some milk. So those are Ambien stories. Cannabis works better. It also helps dampen neural excitation, and so therefore works for seizure disorders, and helps decrease damage in some stroke issues and traumatic head injury. It also prevents neural inflammation, as we saw on the films, and helps with Alzheimer's, Parkinson's disease, and Huntington's chorea. It also works on the GI tract. It helps with gastric motility. And the thing about cannabis is how it works through the endocannabinoid system, which I'm going to move on to next, is that it works both to increase and to decrease. And it increases if there's not enough, and it decreases if there's too much. So it definitely, if there's some type of feedback mechanism that we don't totally understand yet. But it works in the GI tract, on irritable bowel syndrome, on Crohn's disease, or ulcerative colitis, and regional enteritis, or any hyperactive, or even constipation. It actually works well for constipation. So what does it do in psychiatry? Because it also works on our minds, as we all know. So it works, actually helps in schizophrenia. It helps people be able to function. It decreases psychotic symptoms. I have patients who tell me that if they're using cannabis, they don't hear their voices. Now, that's a pretty positive thing. We know it works on anxiety, depression. That's what it works the best on. And when we're bummed out or upset or mad about something, all you have to do is smoke a little joint, and you look at life and you go, you know, it isn't as bad as I thought it was. What the hell was I worried about there? That's basically how I see it work. It also works on bipolar disorder. There's case studies show that the people who used cannabis instead of their pharmaceutical meds felt that the cannabis did much better than the pharmaceutical meds. Most of what I'm talking about comes from studies that I've read, and I'm not listing the studies, but if you ever need to find out, I probably could find where they came from. Also, it works for post-traumatic stress disorder, and there's actually a receptor in the brain that suppresses memory of traumatic events and decreases fear in people with PTSD, or post-traumatic stress disorder. It works also for ADHD, and they did a study with, I think it was a study on the internet that they asked 4,400 people whether it worked, and they all felt it worked better than any of the medications that they've been on. And so basically how it works in ADHD is the people with ADHD have trouble focusing, have trouble staying to task. And when you do cannabis, it allows you to focus. I have a story about a patient of mine who was come in, he was mid-20s, maybe a little older than that. But anyhow, he said that when he was going to school, he never smoked cannabis in high school because his parents were religious and felt that it was evil. And so he said he had ADHD and he got D's and F's, and he said, I just thought I was a dumbass. And he said, then I moved in with friends who were smoking cannabis, and he started smoking cannabis with them. And he said, you know, I could read. I started reading, and I started enjoying reading, and then I went to college. And he said, you know, I'm near the top of my class in college. I wasn't a dumbass. I didn't even smoke more pot. So, cancer, let's talk about that a little bit. What we find out in cancer is that the endocannabinoid system, which is the system through which cannabis works, provides innate protection against tumor growth. It decreases metastasis, it decreases angiogenesis, which is blood flow to tumor, and we all develop cancer in our bodies at some time during our life. And it totally depends on our immunity, whether or not these cancer cells get a blood flow and then develop into something that's going to take us down. And cannabis is one of the things that helps prevent that, as we know, as well as help treat it if we have that, where we are so unlucky as to get that. It also will selectively kill tumor cells topically and leave healthy cells intact. There's not many things that do that very well. Let's see. So, how does cannabis work in the body? Cannabis works in the body through the endocannabinoid system, which is a pre-existing system in our body. When I first started doing cannabis consulting, I thought I knew everything about cannabis. I've been smoking it since 1967. I live in Trinity County, where a lot of people grow it and a lot of people use it. I've dealt with it in my practice multiple times, but when I got into my cannabis practice, I didn't know much, to tell you the truth. Because they don't let us know much. They try to keep it secret from us. They don't want us to know what works because they'd rather sell us their drugs that don't work. So basically what the endocannabinoid system is a system in our body that regulates every physiologic system in our body in some way or modulates it in some way. And it is made up of cannabinoid receptors, and there's about 1 million of them in your brain, CD1s, and there's another 1 million of them in the rest of your immune system and throughout your body, CD2 receptors. And they are stimulated by endocannabinoids, which are produced throughout every major functioning system in your body. And they go to and stimulate the receptors, and what the receptors do is what I just went through. Decrease nausea, decrease anxiety, that whole list of things is what these receptors do, the function. And there's 1 million of them in our brain, and there's 1 million of them in our body, and they do 2 million protective things for us. 2 million protective things. Heck, we don't have a clue what this does. In fact, the researchers say that the endocannabinoid system, if it did not exist in our human body, we would not live as long, we would not be as healthy, and we would not be as happy. That's one of the things that the endocannabinoid system regulates, and the only system in the body that we know that regulates is happiness. So, I mean, I don't need cannabis to be happy, but it sure helps me see through a lot of the stuff that makes me unhappy. I'll tell you that. So how does the cannabis plant work in our body? The cannabinoids in the cannabis plant, and THC, which is one of the cannabinoids, works, they have the same physical structure as the endocannabinoids that are produced in our body. And what we found was that the endocannabinoids were first, and then the cannabis plant evolved these cannabinoids that somehow fit into our endocannabinoid system. Now, does that sound like a mistake to you, or does that sound like a God-given gift? What do you think about that? I don't know. There are over 100 different cannabinoids in every plant. THC is only one of them. And THC just acts like every other cannabinoid until you heat it to 160 degrees or mix it with alcohol, at which time it decarboxylates and becomes psychoactive. So in some of the medicines that I'm going to talk about making, you just don't heat the cannabis or mix it with alcohol, therefore they're not very psychoactive. And people like me, who's been using cannabis since 1967, I don't feel them at all. And some people who are sort of don't use cannabis a lot can't feel them. So how do you use cannabis? You basically, the easiest and fastest and the most common way to use cannabis is by smoking it. It happens pretty much instantaneously, and it lasts 3 to 4 hours. You can smoke it in a joint, you can use a pipe, you can use a bong, you can use vaporizers, which seem to be the new and upcoming thing, and they're supposed to be, they seem to be the less toxic thing. With me and a vaporizer, I've been smoking too much. I'm used to smoking out of a pipe. I like the taste out of a pipe. I can tell when I'm high. I smoke a vaporizer. I can't tell when I'm loaded until I stand up and fall down, you know? It's just too much. But it's okay, it works, and it's a good way to get it. However, if you heat cannabis, you get 3 times the potency in twice the time. And so if you have a big issue, you want to heat cannabis, you don't want to smoke it. The trouble with eating cannabis for me is I just don't like that tired, it's extremely sedative, and you get this tired, sedated, tired, stupid, lazy feeling, which I don't like. So I can't eat cannabis in that form. But a lot of people do eat it. And, you know, we were talking about brownies and cookies and candies. The only thing I can eat a candy occasionally because it's a very low dose. But cannabis sort of knocks my socks off. I can't really eat it in that form. So basically, and you can also make tinctures. Let me do that first. Tinctures, I thought, are by definition alcohol. So if you soak cannabis in alcohol, it is going to be very psychoactive. And it requires a very low dose, so you have to be careful, because I've seen people have a full-on hallucinogenic experience behind tinctures where they didn't know who they were, where they were, or what they were doing. So you gotta be careful. You don't want to do a shot of that stuff. It's not alcohol, it's very potent stuff. So another way to eat cannabis is in a non-psychoactive form. And so that's how I like to eat it myself, because I don't like the feeling. And so I stumbled on to how to do this. Basically what you do is, if you don't heat it or mix it with alcohol, it's not going to be psychoactive, or at least it's going to be minimally psychoactive. So I just fill a jar with bud, I cover that with grapeseed oil, I cap it and shake it, put it in the refrigerator. I personally leave mine in for 3 or 4 months, but if you don't have any, you can strain some off within a month. And now you have a medicine that's not going to get you loaded, and that you can take by the tablespoon. So 2 tablespoons of that gives me 6 to 8 hours of pain relief, and I'm not high. 2 tablespoons of that lets me sleep through the night, wake up without a hangover, pain-free. But that's not what I developed it for. I developed it for big time pain, because I can't smoke myself out of back pain. I have to eat myself out of back pain, because again, you're getting 3 times the potency when you eat it than when you're smoking. And so, but because I don't like to eat it in brownies or cookies, because you just can get too loaded, then I eat it in this grapeseed oil mixer. And so I'll do like 3 tablespoons right away, and then I'll wait an hour and a half. If I'm not out of pain, I'll do 2 or 3 more. Actually, an hour and a half to 2 hours, because it takes 2 to 2.5 hours to get fully there. But if I'm not there in 2.5 hours, 2 to 2.5 hours, then I'm going to take 2 or 3 more. And when I'm done with it, I'm just like I am now, because I'm on it right now. I can't get up in front of people and speak without taking some kind of cannabis substance. So I'm on a grapeseed oil. Great, I have PTSD. So being around a lot of people and in front of a lot of people is a scary experience. So basically, there are other preparations that you can use. I'm going to tell you why I use the grapeseed oil for you. Grapeseed oil is an anti-inflammatory in its own right. It's omega-6 and antioxidant. And a lot of the properties, a lot of the things that cannabis does is because it's an antioxidant. All right. So other ways to do the non-psychoactive THC. You can grind it up and put it in capsules. You can do keef, just put keef in there. You can keef your plant, which is just shake off the trichomes. You can make hash, and as long as you don't mix it with alcohol or heat it, none of that will get you loaded. And there are people I know I talked to last week that just pull the buds off the plants and throw the bud in like a chew and do that all day long. It seems a little rough, but yeah, there's the guy who does it right there. So it is a broad uncommon. The other way to use cannabis is topically, and there are plenty of creams. My wife makes a great cream, which we call magic cream, and it's made with olive oil. We'll get cannabis into olive oil. We usually, again, do that full process, and then we mix that with cocoa butter and coconut oil, and maybe a little beeswax or something for smell like vanilla or something. And it works great. I mean, we call it magic cream because it works on anything you can think of. It works on any kind of topical pain. It works on top of an itch, because itch is just a sublingual pain. And it works on joint pain. In fact, an old Mexican trick is you soak cannabis in alcohol, both in alcohol, and then you rub that on the joints. I learned that was about 25 years ago. That's a good one for that. Actually, it's a good way to store cannabis in Mexico if you don't know where to get it. You just see an old arthritic lady and ask her how she treats her arthritis. She'll be glad to tell you. All right, myths of cannabis. The myth that cannabis is severely addicting is absolutely ridiculous. The research shows that cannabis is about as addictive as caffeine. There was 2 groups that went about looking at this. They looked at cocaine, amphetamines, heroin, caffeine, and cannabis. And they felt that caffeine or the cannabis was about as addicting as caffeine. One group and the other group said that cannabis was less addicting than caffeine. So cannabis is less addicting than Pepsi Cola. That's sort of the way it works. Now, as far as the gateway theory goes, that's been proven wrong by multitudes of things. And what I tell people, if I get that from people, the easiest way to do it is, I said, just all you have to do is pull your computer up, look at graphs of the rise and fall of cannabis, the rise and fall of heroin, the rise and fall of cocaine, the rise and fall of amphetamines. You'll see there's absolutely no correlation between the rise and fall of marijuana and the rise and fall of these other drugs. So therefore, how can it be the cause of it if there's no connection between it? That makes absolutely no sense. So we've heard it addressed before about why is cannabis illegal? Cannabis is illegal because it's in Schedule 1, period. That's the main way they keep it illegal for us. Schedule 1 is a total lie, you know, because it has to be harmful to us. We know that no one has ever died from cannabis. The DEA judge that I think you were talking about earlier said that cannabis was the safest therapeutic substance that he has ever seen or researched. And there's not enough receptors and respiratory drives in the brain to kill anybody. So you can't overdose on cannabis, even though you tried. And there were a couple nights I think I tried that. So basically, why do people come in? Why is there a lot of people trying to use cannabis? They're trying to use cannabis. Most of the older people I see because they're tired of the drugs they're dealing with. They're tired of the side effects of the narcotics. They're tired of the constipation. A lot of people have anger management problems. I know I can't do narcotics because I have PTSD and I get huge anger management problems. And there's a whole new gamut of people coming into our world from Iraq and Afghanistan who have severe PTSD, and we're going to see a lot more of it. And finally, actually, the aid has allowed vets to use cannabis because there is a receptor in the brain that reduces memory of traumatic events, like I said earlier, and they finally had to because of that. One of the reasons why I do this is because there are just too many drugs out there. There are way too many drugs. I would say 50% of the drugs that are prescribed are absolutely useless or overdose. And people would be a lot better without them. And we now are seeing that the overdoses of narcotics in our teenagers has now surpassed motor vehicles as the #1 cause of teenage deaths. And this got real bad when we got Oxycontin on the market because that's what's happening. The new party time is the new narcotics. That every 19 minutes someone dies of an overdose of a pharmacological medicine. And what our board of supervisors and our council has done to us is force us to go back to pharmaceutical medicine because they've taken away our schoolers and now they want to take a right to grow away. And we have to stand up for ourselves because, you know, cannabis is used, like I said earlier, in its most natural form. It's used in its most natural form. It treats more medical problems than any medicine that I've ever prescribed in my close to 50 years of practicing medicine. And it does it better than a lot of the pharmaceuticals that were developed for that particular drug. Seed-bearing plants for our benefit and well-being. If this isn't one of a God-given gifts, then I don't know what one is. And how dare they take that away from us?
Absolutely.
Thank you very much.
Thank you. That was Dr. Terrance Malee. He does a great job.